When I was younger, I lost my aunt to something that should have been treatable, an ectopic pregnancy. She lived in a small town in India where she went to her local doctor days after severe vomiting and stomach pain. He dismissed her complaints and said that she had probably eaten something bad. But what he didn't know, or didn't take the time to see, was that she was suffering with an internal bleeding. And by the time her condition was recognized for what it truly was, it was too late. Her death was preventable, and it made me realize that healthcare is not just about medicine, it's about being heard. It's about whether the system takes your pain seriously. My aunt didn't die because help didn't exist. She died because help didn't truly hear her. That loss stayed with me, and it became the lens through which I saw everything that came forward. I knew something about the way we approach health, especially women's health, is deeply broken. And that this is why I chose global health, and why I believe listening is the most powerful form of care. Years later, I was in Kibera, Kenya, working with CFK Africa on their Girls Empowerment Program, which is a community-driven initiative that helps girls build leadership skills, access reproductive health education, and continue their education. So one afternoon, we went to a school in Kibera, which is one of Africa's largest informal settlements. I'll never forget talking to a young girl. She was barely 16, and she had recently become a mother. She told me that her teachers refused to teach her after she had given birth. She said quietly, "They look at me as if my life is over." Her words echoed the same injustice that took my aunt's life. Different country, same story. Women and girls being unheard, their experiences dismissed, their potentials already decided for them. If that girl had access to supportive teachers, to accurate information about her health, and to a community that believed in her potential, her life could look very different. She could finish her education, she could support her child, and she could lead others like her. The good news is that's exactly what the Girls Empowerment Program is working to change. Through the Girls Empowerment Program, girls meet weekly in safe spaces where they're often led by mentors from the same communities, where they discuss leadership skills, health, rights, and education. But what makes this program powerful is not what's taught, it's what's heard. So when this program was first launched, many girls said they didn't just want workshops, they wanted help returning to school. So that's exactly what CFK did. They partnered with local teachers and parents to create a reintegration model that ensuring that the young mothers got the support they needed to go back to school after pregnancy. This shift happened because the girls asked for it. And this is what it means to center the voices of those living the challenges. During my time in Kenya, I saw this approach over and over again. Youth leading peer discussions, community health workers co-creating outreach efforts, and mothers training other mothers. Each example taught me that the communities already hold the wisdom to solve their problems. Our job is just to listen to them deeply enough to hear it. As global health professionals, we often talk about community-led development, but leadership on paper doesn't mean participation in practice. Too often, we design interventions for the communities, not with them. We write policies that look strong on paper, but doesn't reflect the realities on the ground. The people closest to the problem must be the ones designing the solution. And that means changing the way we define expertise. An insight of a mother in Kibera or a teacher in rural India is as vital as of a researcher or a policymaker. When we design an intervention, we must begin with listening, not with assumptions. When we evaluate success, we must ask communities what success means to them, not just what our metrics say. Imagine a world where no woman's pain is dismissed, where no girl is told her life is over, where every initiative begins not with a proposal, but with a conversation, where every program is created by those who will live its impact. As global health professionals, we should not design in isolation and must stand with the communities. We must bring people together with resources and people facing the challenges. And we must build a system that reflects real lives. So if there's one thing I want you to remember today, and that is, the people closest to the problem must be the ones designing the solution. Thank you.